interested in the profession, and why did you personally choose it?
So my father's a dermatologist, so I knew of it at a very young age. But I went into medical school thinking I would be a pediatrician.
Okay.
But for various reasons, I decided dermatology was a better fit, mostly because I liked the medical aspect of seeing patients, but I also like doing a little surgery, and dermatology allows you to do both, and plus you get to see all age groups.
Okay. All right. Describe your typical day.
At work?
Yes.
So I come in and I have amazing staff who help me all day, and I have a wonderful opportunity then to just see patients and talk with them, and they help me do all the other peripheral things. So my typical day is fairly busy and talking to a bunch of people and solving problems. But, you know, is that kind of what you want?
Yeah.
Okay.
Yeah.
That works.
What would you say to someone who wanted to pursue the career themselves?
Enjoy it.
Advice.
I think that the most important thing is it's a long road. So you've got to go, you know, college, then 4 years of med school, then 4 years of residency.
Yeah.
So make sure you enjoy it. My father always said that medicine was a non-decision because there's a lot of different paths you can take within medicine.
Yeah.
So just make sure you like it. And you don't have to know you want to be a dermatologist
Right
when
away.
you start
Yeah.
medical school. You don't have to determine that till later on. Yeah.
What are some of the things that you gained throughout? Because how long have you been doing this?
Almost 15 years.
Yeah.
So 14 years, yeah.
It's lots of knowledge.
Yeah. So what have I gained?
Yeah.
Well, I think, you know, medicine is a practice. So you're always learning something new. Things are changing. It's the hardest part usually isn't the patients. It's all the billing and the changes with insurance and getting things covered. And, you know, so that part of it is what is the constant change for us.
In college, what classes did you find to be the most beneficial?
For where I am now?
Yeah.
Well, that's an interesting question. I think, you have to do the sciences because you need that background for medical school.
Right.
I don't really know that those help me day to day now. I would say probably the most beneficial classes are more of the ones that are like philosophy or like, you know, kind of, I deal with people, right? So what's going to help you work better with people?
Okay.
That makes sense. So those are the ones I remember more.
Yeah.
Maybe, I don't know if they're helping me, but I remember them.
You
so
like
whether
them?
they, yeah, I don't remember organic chemistry except for not liking the lab.
Yeah. Oh.
But, you know, I needed all of that, but that's not what I remember. I remember the other kind of fun courses that work the other side of the brain.
Yeah. How do you feel the dermatological field has changed throughout the years? Like, do you notice, new technology, new procedures, things like that?
The cosmetic side is definitely, you know, more larger than it was when I first started. And we just have more options. Actually, the other biggest, probably a bigger change has been some of the medications we have for certain conditions.
Okay.
That can be cured almost, they can really make a big difference. So the biologics for psoriasis and some of the newer medicines we're getting now for eczema are life-changing for patients, which is amazing.
Yeah.
So we have more things offered to us now, which is fantastic.
Okay. As a doctor, what do you feel that your strengths and weaknesses are?
Okay. That's a good question. I think I can always be better, right? And I try to get to the heart of the real issue, but I don't think we always get there, right? You know, my appointments, the way they're pretty quick.
Yeah.
So sometimes it's challenging. But I think that's my goal always, is to figure out what's really going on and solving the problem. And sometimes I can do it and sometimes I can't, right?
Right. What do you find unique about dermatology in general?
Versus other fields?
Yeah.
So what I like about it is that, you know, I can see a 6-month-old baby and then see a 90-year-old man and then see a a 30-year-old and a 40-year-old,
Right.
and they'll all have different problems. So I like that variety, and I like that some things can be fixed quickly, or you can just cut them out and be done with them.
Right.
Some things are more chronic management, and so there's a lot of different aspects to the practice. So some medical fields, I mean, you're basically, most of it is just medicine. You don't do any surgery, or if
Right.
you're always in the OR, you don't do any medicine.
Right.
So I like the diversity in that aspect, and I like the different ages.
Yeah. Seeing different people.
Yeah.
Do you find it difficult juggling home and work life?
Yes, I think that it is. I'm fortunate that I have great support,
Mm-hmm.
and that's the only way you can do it.
Right.
Yeah, because it is.
Yeah.
You leave a full-time job and go to a different full-time
Yeah.
job. But dermatology, I think, offers you a much better chance to do that. Because usually when I leave, I get to leave, and I don't have a ton of phone calls and other things that come up.
Right. Okay. Last one. Tell me about any professional friendships you've made, like, throughout the years. Have you?
With other colleagues?
colleagues,
Absolutely. So I have some close friends that I've met post-residency while being here, and it's nice to have them just as someone to bounce things off of.
Okay.
Right, if you have questions. Are you having this issue with, and a lot of times it's not necessarily the medical stuff, it's the ancillary stuff.
Okay.
The billing, the staff,
Right.
Staff issues, these kind of things it's nice to have that support with.
Thank you. That
So,
was
is
it.
that all you need?
Yeah,
Okay.
that's it.
Okay.
Thank